Part B. In this part of the test, you'll hear 6 different extracts. In each extract, you'll hear people talking in a different healthcare setting. For questions 25 to 30, choose the answer A, B, or C, which fits best according to what you hear. You'll have time to read each question before you listen. Complete your answers as you listen. Now look at question 25.
Hello, Dr. Salvos. This is Dr. Broderick from the emergency department. I'm calling you with regards to an admission to the hospital medicine service.
Right, yes. Hello, Dr. Broderick. I'm the admitting physician for hospital medicine. Can you tell me more about the patient and why he needs to be admitted from the emergency department?
Sure. So the patient is a 68-year-old man with a past history of CHF, DM2, and a chief complaint of shortness of breath for 3 days. Chest x-ray shows a right lower lobar pneumonia. His vital signs are normal, but his BUN is 36.
I see. It sounds like he meets CURB 65 criteria for an inpatient admission. Have you started him on any medications in the emergency department?
Yes, we have given him supplemental oxygen and started him on breathing treatments. He will also be getting empirical antibiotic coverage. If there are any other orders you'd like me to place, let me know, and I'll do so.
Question 26. You hear a speech pathologist talking to the wife of a patient who has recently suffered a stroke. Now, read the question.
I just don't really understand why my husband can't speak properly anymore. Is it a result of brain damage?
Problems of this type are a result of damage to the brain, yes, but it's important to note that these issues haven't affected your husband's intelligence.
No, of course. I know it's still him. It's just frustrating when we can't talk like we used to. Will he get better eventually?
Your husband has shown improvement already, and we're confident that this will continue with regular sessions and practice. Patients tend to show the greatest change within the first 6 months, which is why we've planned such an intensive schedule for him during this time. We're confident that we'll see great strides in your husband's condition over the coming months.
Question 27. You hear a trainee doctor asking a senior colleague about chest tubes. Now read the question.
I'm still just a bit unsure about chest tubes. I was hoping you might be able to give me a bit more information.
Okay, sure. So you know about the 3 chambers on the chest tube, right?
Yep, there's the collection chamber, the water seal chamber, and the wet or dry suction regulator.
Right. So, as the air from the pleural space passes through the water seal chamber, you should see gentle fluctuation in the water every time the patient breathes. This is called tidling. If you notice that tidling is no longer present, the tubing may be kinked or obstructed, or the patient's lung may have re-expanded.
Okay.
You should also make sure the chest drainage unit remains below the level of the patient's chest at all times.
Question 28. You hear a pharmacist talking to a customer about pain relief. Now read the question.
Hello, can I help you?
Yeah, I get terrible backache, and my friend said you could give me some codeine for it.
Do you have a prescription from your doctor?
No, but I don't want the full-strength stuff. I only need the weaker one. You know, they mix it with ibuprofen or paracetamol, so it's not as strong.
Ah, okay. Well, first of all, there's been some research done recently that suggests that low-dose codeine doesn't offer much more pain relief than paracetamol or ibuprofen alone. We're not actually authorised to provide codeine without a prescription anymore, so I'd recommend picking up some alternative pain relief from the first aisle by the front door.
Question 29. You hear a trainee nurse receiving feedback from his tutor. Now read the question.
How do you feel you handled the patient's concerns?
Well, I think I was okay.
Mm-hmm.
Maybe I wasn't as confident as I could have been. I'm still quite nervous about advising patients. I guess I just need more experience to gain confidence.
Maybe, but I actually don't feel that was an issue for you. Do you think there's anything else you could have done for the patient during your examination? Well, you could perhaps have tried to be more reassuring rather than just stating the facts. Sometimes patients need to feel like their anxieties are being heard.
Yeah, I actually think I did cover this with the patient, though. He talked through his concerns while I was examining him.
Well, it's not enough for the patient to say they're feeling worried. You have to show that you're listening and reassure them that you're working with their best interests in mind.
Question 30. You hear two doctors planning their patient care schedule. Now read the question.
We have 24 patients in total to see today across 2 bays, and unfortunately, we only have 4 staff members. I think we should divide ourselves into 2 teams. Would you agree?
Absolutely. Also, I think we should see patients according to their national early warning score. That way we'll get through all those who have urgent requirements before lunch. Then we can be sure that the most pressing investigations are performed earliest, and the sooner we get those organised, the better. Phlebotomists will be coming to the ward at around 1:30, so any blood forms should be given to them then.